This is the complete scientific case for apple cider vinegar and blood sugar control, backed by over 2 decades of clinical research and a landmark 2025 meta-analysis that changes what we know about this ancient remedy. Apple cider vinegar. It sits in nearly every kitchen cabinet in America, and yet most people have no idea what it's actually capable of. For thousands of years, vinegar has been used as medicine. The ancient Babylonians were fermenting date palm vinegar to treat ailments as far back as 5000 BC. Hippocrates, the father of medicine himself, prescribed vinegar mixtures to heal wounds and treat respiratory problems. Roman soldiers carried a vinegar water drink called pasca to stay hydrated during long military campaigns. But here is where things get interesting. Modern science is now confirming what these ancient civilizations seem to understand intuitively, and the evidence, particularly when it comes to blood sugar, is surprisingly strong. Let's start with what apple cider vinegar actually is. It's created through a 2-step fermentation process. First, yeast converts the natural sugars in apples into alcohol. Then, a specific type of bacteria called acetobacter transforms that alcohol into acetic acid, which is vinegar's primary active compound. But apple cider vinegar is more than just acetic acid. As a fermented product, it also contains phenolic compounds like catechin, ferulic acid, caffeic acid, and gallic acid. These compounds play documented roles in glucose metabolism and carry anti-inflammatory and antioxidant properties, making apple cider vinegar a more synergistic product than plain acetic acid alone. Now, you've probably heard people talk about the mother, that cloudy, cobweb-like substance floating in unfiltered apple cider vinegar. The mother is a colony of beneficial bacteria, enzymes, and proteins that form naturally during fermentation. It contains dozens of strains of good bacteria, often referred to as probiotics, that support digestive health and immune function. Though it's worth noting that by strict clinical standards, apple cider vinegar isn't technically classified as a probiotic because it often lacks the specific measured strains required for that designation. Still, the mother is what separates raw, unfiltered apple cider vinegar from the clear, pasteurized versions on store shelves. So what does the science actually say about blood sugar? Let's look at the numbers. The most comprehensive and recent evidence comes from a 2025 meta-analysis published in Frontiers in Nutrition, conducted by researchers at Shiraz University of Medical Sciences. This study pooled data from multiple clinical trials and found that apple cider vinegar significantly reduced fasting blood sugar by an average of nearly 22 milligrams per deciliter. It also reduced HbA1c, which is the gold standard marker for long-term blood sugar control, by 1.53 percentage points, and it increased insulin levels, suggesting the body was doing a better job of managing glucose. Perhaps most striking, the researchers found a dose-response relationship. For every additional 1 milliliter per day of apple cider vinegar consumed, fasting blood sugar dropped by 1.255 milligrams per deciliter. That's a measurable linear effect. An earlier meta-analysis had already shown that apple cider vinegar consumption decreased fasting plasma glucose by about 8 milligrams per deciliter and HbA1c by 0.5 percentage point. Studies evaluating vinegar intake over 8 to 12 weeks showed HbA1c reductions of at least 0.14 percentage points, and in one specific clinical trial, 60 patients with type 2 diabetes were divided into 2 groups. Those who consumed just 15 milliliters of apple cider vinegar per day for 1 month saw their blood sugar drop from 175 to 156 milligrams per deciliter, and their HbA1c fell from 7.56% to 7.03%. Multiple small studies have shown that vinegar can lower post-meal blood sugar spikes by up to 20% when consumed before eating carbohydrates. Some clinical studies have even noted reductions in postprandial glucose levels of up to 34% when taken before high glycemic meals. But how does it work? The primary mechanism appears to be delayed gastric emptying. When you consume acetic acid before a meal, it slows the rate at which food leaves your stomach and enters your small intestine. This buffers the rise of blood sugar levels after eating. In one study of 10 healthy volunteers, researchers found that vinegar ingestion significantly reduced both blood glucose and insulin responses after a starchy meal. The study authors wrote plainly that the mechanism is probably a delayed gastric emptying rate. There's also evidence that acetic acid increases glucose uptake by cells, meaning your muscles and tissues absorb sugar from your bloodstream more efficiently. But here's where the story takes a fascinating turn. In 2007, Arizona State University nutrition professor Carol Johnston and registered dietitian Andrea White published a landmark study in the journal Diabetes Care. They gave apple cider vinegar to type 2 diabetics at bedtime, not before a meal, and the results showed that morning fasting blood sugars were significantly lower, with reductions of up to 6%. This challenges the gastric emptying theory entirely, since the vinegar wasn't consumed with food. It suggests there's an additional mechanism at work that researchers are still working to fully understand. Now, here's the part most people skip over. The risk. The American Dental Association is warned that regularly drinking apple cider vinegar can degrade tooth enamel, leading to pain and increased risk of tooth decay. In one laboratory study, tooth enamel immersed in vinegars with pH levels between 2.7 and 3.95 lost between 1 and 20% of its mineral content after just 4 hours. Beyond dental concerns, excessive or long-term intake has been linked to weakened muscles, irregular heart rhythms, and depleted potassium levels. And for people with gastroparesis, a condition where the stomach already empties too slowly, vinegar can make the problem significantly worse. A pilot study in people with type 1 diabetes and gastroparesis found that apple cider vinegar further reduced their already slow gastric emptying rate. If you take insulin, digoxin, or certain diuretics, you should know these medications may interact with apple cider vinegar. It is also important to acknowledge the quality of the evidence. In the 2025 meta-analysis, 5 of the included trials were classified as low quality with high bias risk. 1 was moderate, and only 1 was high quality. The evidence for fasting blood sugar and insulin was rated as moderate grade, while hemoglobin A1C and insulin resistance markers were rated low grade. This is real science with real results, but is not yet the kind of ironclad evidence that would change standard medical guidelines. So if you want to try it, here is what the research supports. 1 to 2 tablespoons, that is 15 to 30 milliliters, diluted in about 60 to 80 milliliters of water, consumed right before a high carbohydrate meal. Start small and work your way up. Drink it through a straw to minimize contact with your teeth, and never brush your teeth for at least 30 minutes afterward. The evidence shows it is less effective with low-carb meals or meals high in fiber, so timing and meal composition matter. This is now a market valued at over $723 million in 2025 and projected to reach nearly $1.3 billion by 2035. PepsiCo's $1.95 billion acquisition of the apple cider vinegar-based brand Poppi in March 2025 tells you everything about where industry money is flowing, and Bragg Live Food Products is sponsoring a rigorous randomized, double-blind, placebo-controlled clinical trial expected to begin in early 2026, which could provide the highest quality evidence yet. Apple cider vinegar is not a miracle cure. It is not a replacement for prescribed diabetes medication or the guidance of your healthcare provider. But the cumulative weight of evidence, from ancient Babylon to a 2025 meta-analysis in a peer-reviewed journal, suggests that this simple, inexpensive pantry staple has a legitimate role to play in blood sugar management. The science is real, the effects are measurable, and the story, after 7,000 years, is still being written.